Have you ever left your doctor's office with more questions than answers? Maybe you nodded politely, accepted a prescription, and walked out, but inside you weren't sure what any of it really meant. I've seen that happen countless times, and I'll tell you, when it comes to high blood pressure, silence can be dangerous. High blood pressure is often called the silent killer for a reason. It doesn't shout, it doesn't warn, it quietly wears away at your arteries, your heart, your kidneys, your eyes. Sometimes for years before you ever feel a symptom. By the time you do, damage may already be underway. And yet many people think, I'll just take the pill my doctor gives me, and that will solve it. But here's the truth. Medication is only part of the story. Pills can help. Sometimes they're even life-saving. But they don't replace understanding. They don't replace asking the questions that uncover why your blood pressure is high and what you can do about it beyond swallowing a tablet every morning. I once had a patient, I'll call her Mary. She was 62, lively, the kind of grandmother who always had cookies ready for her grandkids. She had been taking blood pressure medication for nearly a decade. One day she came to see me and said, "Dr. Harris, I've been on these pills for years, but I still don't know why my blood pressure is high. Is it just my age? Something else?" Nobody's ever explained it. That moment hit me hard. Mary had been faithfully following instructions, but she was never truly informed. Together, we asked the questions she'd never been encouraged to ask. We reviewed her history, her sleep, her stress. We discovered that one of her other medications was raising her blood pressure. Adjusting that changed her numbers dramatically. For the first time in years, Mary felt like she understood her own health. All it took was a question. Now, I want you to imagine yourself in that same chair. Your doctor has just told you your blood pressure is high. Instead of nodding and leaving, what if you leaned in and asked, "What's really causing this? Do I need medication right away, or do I have options? Which lifestyle changes would help me most? Do you feel the difference?" That moment transforms you from a passive patient into an active partner. And believe me, doctors respond to that. When a patient starts asking thoughtful questions, we listen more closely, we explain more carefully, and together we find better answers. That's what today's video is about. 8 life-saving questions to ask your doctor about high blood pressure. These questions aren't complicated. You don't need medical training to ask them, but they can change everything. From avoiding unnecessary medication, to uncovering hidden causes, to catching red flags before they become crises. When I turned 60 myself, I began to think differently about health. I realized that vitality isn't about fighting age. It's about living wisely. It's about clarity. And clarity often begins with a single question. So today, I'll walk with you through the 8 questions that I believe every person with high blood pressure, or even at risk of it, should ask. Questions that go beyond the numbers on a chart and reach into the heart of your long-term health. Because at the end of the day, the most powerful medicine doesn't always come in a bottle. Sometimes it begins with the courage to ask. Question 1. What's causing my high blood pressure? Before you can solve a problem, you need to know its source. Too often, patients are handed a prescription without anyone stopping to ask why their blood pressure is high. I've seen patients whose hypertension was triggered by poor sleep, another whose thyroid imbalance was the culprit, and many whose medications, antidepressants, decongestants, even simple pain relievers, were silently pushing their numbers higher. Asking, "What's causing my high blood pressure?" is like turning on the light in a dark room. It may reveal lifestyle habits, underlying conditions, or even reversible causes. And when you discover the root, sometimes you can treat the cause instead of just chasing the symptom. Question 2. Do I really need medication right now? Now, don't get me wrong. Blood pressure medication can be life-saving, but starting medication is a big step, and sometimes it's prescribed after just 1 or 2 high readings in the office. A patient of mine once panicked after a 150/92 reading during a stressful clinic visit. Her doctor wanted to start medication immediately, but at home her numbers were consistently lower, averaging 100s and 30s over 80s. She didn't need medication, she needed reassurance and some lifestyle tweaks. By asking, "Do I really need medication right now?" Or can we try other options first? You open the door to a more thoughtful approach. If your numbers are dangerously high, yes, pills may be necessary immediately. But if they're borderline, your doctor might give you time to lower them naturally with lifestyle changes. Question 3. What lifestyle changes would help me the most? Here's the truth. Not all lifestyle changes are created equal. Eat better and exercise more sounds good, but it's too vague. I had a patient, James, who tried jogging every day to lower his blood pressure, but he had arthritis and the pain set him back. Instead, we focused on swimming and improving his sleep. Within months, his blood pressure dropped and his pain improved too. Asking your doctor, which lifestyle changes matter most for me, helps you target your effort. Maybe it's reducing sodium, maybe it's losing a few pounds, maybe it's improving sleep or reducing alcohol. The key is personalization, because small, tailored changes, the ones you can actually stick to, often work better than generic advice. Question 4. How often should I monitor my blood pressure? Blood pressure is a moving target. It rises when you're stressed, falls when you sleep, even spikes after a cup of coffee. That's why relying only on office readings can be misleading. Some patients check their numbers 10 times a day and end up more anxious. Others never check at all and miss dangerous spikes. The sweet spot lies in between. Generally, if you're newly diagnosed, your doctor may want you checking morning and evening for a week. Once things stabilize, a few times a week is often enough. The exact plan depends on your situation, which is why this question matters. When you ask, how often should I check my blood pressure at home? You ensure you're gathering the right data, not too little, not too much. Question 5. What are the signs that my blood pressure is out of control? High blood pressure rarely announces itself, but sometimes it whispers through symptoms you shouldn't ignore. A sudden, severe headache, blurred vision, chest pain, dizziness, shortness of breath. These can all be signals of dangerously high numbers or even a hypertensive crisis. I remember a man in his late 50s who dismissed his frequent dizziness as just getting older. In reality, his blood pressure was spiking to dangerous levels. We caught it in time, but it could have easily gone another way. By asking, what warning signs should I never ignore? You equip yourself with a safety net. It doesn't mean you'll live in fear. It means you'll be prepared, aware, and ready to act if something feels off. Question 6. What is my target blood pressure? And is it the same for everyone my age? One size does not fit all. A healthy 55-year-old may aim for different numbers than an 80-year-old with kidney disease. I've had patients who worried endlessly because they couldn't hit the ideal 120/80. For some, pushing that low actually made them dizzy and increased their fall risk. The truth? Targets must be individualized. When you ask, what's my personal goal? You get clarity. Your doctor can balance your risks and help you aim for a number that protects your health without compromising your quality of life. Question 7. How will we know if my treatment is working, and when should we adjust it? Treatment isn't set it and forget it. Blood pressure medications sometimes lose effectiveness or side effects creep in. Lifestyle changes may shift the picture too. I had a patient named Carlos who was diligent. He took his medication, ate better, and lost 20 pounds. His blood pressure dropped beautifully, but his doctor never revisited his treatment plan. He stayed on the same high dose for years, enduring unnecessary side effects. Asking, how will we measure progress, and when do we reevaluate, keeps your plan alive, responsive, and in tune with your body's changes. Question 8. What long-term complications should I be watching for, and how can I prevent them? Here's the sobering truth. Untreated or poorly controlled high blood pressure is like a slow leak in your home's plumbing. It weakens the structure quietly until one day a pipe bursts. Those bursts can look like heart disease, stroke, kidney failure, or vision loss. But when you ask your doctor, what long-term risks should I prepare for and how do I prevent them? You bring the focus to prevention, not just treatment. That question helps you catch problems early. It reminds both you and your doctor that managing blood pressure is about protecting your future, not just surviving today. Bringing it together. So there you have it. 8 questions, each one simple but powerful. What's causing my high blood pressure? Do I really need medication right now? What lifestyle changes would help me most? How often should I monitor my blood pressure? What are the signs that it's out of control? What's my personal target blood pressure? How will we know if treatment is working? What long-term complications should I watch for? Every one of these opens a door to understanding, to personalization, to prevention. And when you ask them, you're not just managing numbers, you're protecting your heart, your brain, your future. As we wrap up, let me remind you of something important. Managing high blood pressure isn't just about the numbers. It's about being informed, prepared, and proactive. And the simplest way to do that is by asking the right questions. These 8 questions we've walked through today, from finding the cause of your hypertension to understanding your personal targets to knowing the red flags, they aren't just medical talk. They're tools of empowerment. They turn you from a passive patient into an active partner in your care. I want you to picture this. At your next appointment, you walk in not with fear, but with clarity. You sit across from your doctor, and instead of leaving with confusion, you leave with answers. You know what's driving your blood pressure, you know whether medication is truly necessary, and you know how to track your progress with confidence. That's the power of a good question. And here's the truth. You don't need a medical degree to ask them. You just need the courage to speak up. So I'll ask you, which of these 8 questions will you start with at your next visit? Leave your answer in the comments. I'd love to hear it. And before you go, if you found this video helpful, please like, share, and subscribe to this channel. It helps this message reach more people who might be silently struggling with high blood pressure and don't yet know what questions to ask. Together, let's spread knowledge, let's spread empowerment, and let's add not just years to life, but life to our years. Until next time, I'm Dr. Harris. Stay informed, stay proactive, and stay well.